terms of neuropathy, there are 3 million documented cases annually that are getting diagnosed. And, you can look across the board, especially in our country, you can look across the board with diabetes, you can look with obesity, you can look with cardiovascular disease. We have so many problems, and they're starting earlier and earlier and earlier in people's age range. So it used to be later in life. It used to be, you thought maybe the longer term diabetics would get neuropathy. The longer term people who didn't take care of themselves would get it. But nowadays we're seeing neuropathy, kids come in with neuropathy. It's largely in place because of how much toxicity is in this day and age and in this world that we're having to deal with. Neuropathy as people know neuropathy, there are 5 grades of neuropathy, if you want to think of it that way, that people may or may not have heard of. But most people assume neuropathy, or the typical definition of what people believe neuropathy is stage 5. Stage 5 is where you have something burning on fire and it just won't go away. But I want people to realize out there, neuropathy doesn't start that way. It actually starts with an acre of pain somewhere. And maybe that acre of pain goes away, but then maybe it comes back again. And then maybe it goes away, and then maybe it comes back again. And so that could be maybe level stage 1, stage 2. When it starts staying with you, it turns to more stage 3, where it's not it doesn't want to go away. And then it just progressively gets worse from there as it gets into stage 5. So neuropathy really is just when aches, pains start in the body in any given area. And if you don't properly attend to those nerves, you're asking for trouble in the long term. Any person can come to see us, regardless of the age, with any type of symptom you get. And again, just keep in mind, like we talk about, neuropathy can start with just an acre of pain. It could be anywhere. It doesn't have to be in your hands or feet. So it could be in your hips, and it could be in your thighs. It really doesn't matter the actual location of it. What does matter is that they get addressed properly. And so our process here is when a patient gets to the door, we do extensive, or gets through our door, we do an extensive history, because we want to know exactly what that person has been through. So we don't just take, let's say you come to us and maybe it's just your shoulder that's hurting, your neck. We don't just take your neck on, we take your whole body on. We want to see what's going on in this entire body. And so in our experience, it's a wiring network that we're walking around in. We talked about this earlier, how your heart does blood flow to and from your heart all over. Well, your brain and your spinal cord does energy to and from all day long to your parts. In fact, your heart doesn't even work without energy coming from the brain. So to it. So this big wiring network, you can imagine just every section of your skin is actually wired to your brain, which is really cool to think about. Every organ, every bone, every muscle, all these parts in your body are all wired to your brain. So our first assessment is to try to figure out exactly where your disconnects are and where the brain has weak connections, weak energy flow to parts or from parts, either one. So we go through a pretty extensive 88 nerve check where there's 88 primary nerves come off the brain and spinal cord. They go to all your parts. So we go through and check all 88 major nerves and determine exactly where any power outages you have are. And then we actually have a formula that we came up with, and it's our proprietary method of figuring this out, but it's like a cell phone. So, your cell phone should be 100% in the morning and you do all your stuff. Some things drain your power more and some things drain your power less throughout the day that you're doing. But at the end of the day, you should be 75, 80% or 85%, and you go to bed and you charge up. Well, it'd be nice if all of our patients came in at 85% to us and we just made a couple of tweaks and they went up to 100. But the vast majority of people coming to see us after this initial exam are in the 30% range, sometimes even less. I believe last week we saw one at 9.5%. You can imagine how well connected is this with this test we're doing through all these major nerves. And this person's at 10%, 9.5%. not good for their overall health. So through our process, that's the first stage of actually checking the nervous system. And then once your brain actually gets checked the first time, it's the most amazing thing to witness. But once we make all these checks in the body and check, the person can actually feel weakness. So an example would be when I pick my wrist up and I hold resistance against it here, that is actually my C6 nerve. It's coming from here, and the brain sending energy out through this side of the brain, through this nerve, going down into my arm. It's powering up this muscle. So this is just one little test we can do out of a bunch of different tests. And oftentimes we'll do this test to a person and their wrist just gives. Just with a little bit of resistance, their wrist will give. And so that test is an indicator that that's a weak energy flowing nerve. And so that can't be assessed on MRI. It has to be done manually. MRI will show you the actual nerve, but it won't actually show you the energy flowing through it. So that's just one example of one test. But after we do all this type of testing like this, where we go through all these various parts and check them, we'll find all these weaknesses. And oftentimes what happens is we'll go back and show the patient, hey, this was weak before. Let me go check it again. As soon as we check it, a lot of times it's stronger. And what's happening is as soon as the brain feels and is checked properly with each individual nerve, it's like the power company, if you lose power at your house or your building, you got to call the power company and let them know you lost power. That's exactly what that test just did. Your brain feels this power outage and says, whoa, wait, I didn't know I was weak here. So then even the first visit, your brain starts rebooting and actually getting the power back to your part. So once we finish that original testing in the nervous system and get an idea where that person is, then we go through a few more tests, including x-rays, including a test called the pulse test. And it actually measures, there's a surviving side of your nervous system and a healing side of your nervous system. The surviving side is called the sympathetic. A lot of people have heard about it. And there's healing side is called the parasympathetic. And so a lot of our patients come in and the sympathetic side is like this, and the parasympathetic or healing side is like this. So their body's not healing and it needs to heal. That's how we're designed. Big Pharma doesn't want you to believe that your body will heal itself, but it's designed to heal itself. So we really don't heal anything. We help the body get that strength back and help it heal itself. So the pulse test we do is a good measure. It'll show us actually how well functioning this parasympathetic side is. And oftentimes that matches in number percentages where we find our original testing in the whole nervous system. Really interesting. So from that point forward, that first visit is compiling data, starting to test the nervous system, actually getting it to reboot a little bit. And then the next time the patient comes in, between that first visit and the second, we formulate a customized, individualized plan that's not cookie cutter. Every person we see is different. Some come to us in the early phases of neuropathy where it's really, really easy. And other patients come to us in the very latter phases where it takes a lot more therapies, high technologies that we have over a course of time to be able to help them. It's extremely exciting times here at the Nerve Health Institute. This is my 26th year of practice. And for years, I've wanted to go with my patients. So if somebody comes to me with, maybe it's neuropathy, maybe they're paralyzed, maybe they have, other aches or pains that just won't go away, whatever their symptoms are, digestion is not right, they're not sleeping right, I have any energy. For years, wanted to go with those patients 24/7 if I could. And obviously not possible. But so for years, we recommended exercises. We've have Rolodexes full of nerve specific exercises. We've given to them. And it's difficult for people. It's difficult to add other things into your normal day-to-day routine that maybe you're not familiar with. So we wanted some sort of device to be able to help people outside of just a massage gun or having a light for home that may help you. Other things, Vibe Plate, maybe we recommended. But those items you can't necessarily carry around, put in your pocket, and go to the grocery store with, or go cut your grass with, or pick up your kids in line with, or just do your day-to-day activities. Maybe you want to sleep with it on. Luckily, we made this discovery. I've used bioresonance devices for years, but they're big and bulky and kind of scary looking. And you got to keep them inside. I've never used them in my office because they're weird looking, to be honest. But bioresonance, what it does, you have 30 trillion cells in your body, which is crazy to think about. Well, there's 30 trillion cells, and your whole course of your life, your body's trying to maintain health in 30 trillion cells, which trying to maintain 100% health in 30 trillion cells in today's toxic world, good luck. So a lot of those cells over time, they just start to get where they're not healthy. And so this particular device, I want you to imagine each one of those trillions of cells are different, and they each have different tunes, like guitar strings, and they each have their own frequency. And when they're tuned up properly, they can do their job properly. So like your thyroid cells are not tuned the same way as your red blood cells, as your femur cells, as your small intestine cells. They're all different in their tune, in their frequency. And so this company figured it out. I discovered this company at the end of last year, and basically they're a Russian company. They've been in existence for over 30 years. They have over 140 clinical studies they've done on these devices. They started as big ones, and they now they've got them into micro devices where you literally just fit it right in your pocket. There's 3 different ones, and essentially you can target whether you want just the energy in your cells. There's a device for that. This one in particular is more for organs, systems, glands in your body. You can target whatever you want out of those through this device. And they have another one that you can target more deeper detoxification, and actually all the microbes that are around us, help with viruses and funguses and parasites and all those different things. Not only can people use this that have never been here, they can actually order these. We have bodycharters.com. That's a website that we started to teach people about what bioresonance is and how you can use it for home to help yourself even without coming here, which has been my dream, to help people worldwide without, some people don't have the means to come here. Obviously coming here is better when you can do both. But our patients locally here absolutely love them right now. They're helping them with so many different conditions, and 24/7, they're learning every single day more about their bodies, because maybe one day they have issues with digestion, and maybe the next day they're not sleeping too well, and they can actually target programs in here. Like one of them is deep sleep. They can just go into a deep sleep program, boop, and they actually are getting a much better night's sleep. Or the next day they're not going to the bathroom as easy, so they can digest their food. They click on that and they digest their food better. Maybe one day they don't have energy. Maybe another day their hormones are a little messed up. There's all these types of settings in these devices to help with the day-to-day struggle that we have on this planet right now. It is absolutely necessary, and it's becoming increasingly more necessary every minute of every day on this planet, due to all the stuff we talked about, all the toxins and the pollutants and all the other things that are around us that are increasingly getting more and more difficult for your body to regulate 30 trillion cells. So to have something like this in your pocket and be able to use it 24/7 is just an absolute godsend in my eyes, because my family can use it. All my family does. We all have amazing stories we've seen just from the usage we've had out of it. My staff has, and then, like I said, now we've got a bunch of our patients that dozens and dozens of our patients are using it. So, and it's been right now, currently, these devices have been used in over 27 countries. And we're very fortunate enough to be the first doctor in the United States or Canada with these. So I want this country, a lot of my mission is to help not only the people in my area, in South Louisiana. I love our Cajun culture down here. I'm from this area. We don't have a good history of being healthy down here. I mean, our food is fantastic. We love to party. It's just our culture. We like being social, but historically, our Cajun culture has a lot of diabetes, a lot of obesity, and a lot of neuropathy, a lot of cardiovascular disease. And I think I'm speaking for the country when I say that. I'm not saying Louisiana by it of itself. I'm just saying because I'm from here and have witnessed it. So my mission has always been to help our local people, our people of Louisiana, but also especially people of our country and people worldwide that need this help. It's always a pleasure to be able to help people quicker. So that's been my whole mission is, I'd prefer so much if people just got here and hadn't seen 25 other doctors with no results and wasted X amount of money and time and effort, and all along their nervous system would just crash. So I would much prefer people to come to see me at 70% than at 10%. You can imagine if they come to me at 10%, it takes more time and effort from my staff and all our technology. They got to come in with a lot of clinical hours. They got to use this device. We got to do other home instructions we give them. It's comprehensive. The worse you get, you got to do more work to get yourself back up to 85% or more. But if you're at 70%, it costs a whole lot less and we get you better quicker. And you enjoy not a roller coaster of life where sometimes the roller coaster is going straight down. You enjoy a higher quality of life at 85. And then you're not at risk for getting sick as much as the average person is because you're stronger. Your brain's better connected to your parts. You got more energized parts. So when you get here at 70, it's much easier to go to 85. Boom, we're able to get you there versus when you go from 10. So the objective is to get people in as soon as possible. So if you're out there, don't wait with, let's say, an acre of pain that turns into a constant acre of pain, where you've had surgeries, you've had injections, you're doing all these medications, you've been to tons of doctors and nobody can give you answers and give you results. You're much better off coming when that acre of pain just starts and us fix it. And then we keep you there and maintain you and tell you what to do and help you. Our body is literally about flow. If you think of it, it can start, let's just say, with blood flow. And that concept everybody understands, where, blood is flowing to and from your heart all day. There are tons of studies showing that even children, the blood starts flowing through big arteries and it goes to smaller capillaries. And then it goes back into veins. And so there's about 25% of big blood vessels of all your blood vessels. And the rest of them, 75%-ish, are the small ones. And so those small ones get occluded over time for so many different reasons, as we talked about. And so that flow, the better it maintains itself, the healthier your body can be on a cardiovascular level, getting nutrients to your parts. That's just one of the areas of flow. But then you also have like your energy flow, where your brain has to energize all your parts. And that's, in my opinion, even more important than the cardiovascular or the blood flow. So that part is huge, keeping energy flowing to and from the brain. You've also got stuff like lymphatics. Like your lymphatics have to get rid of extra fluid in your body, toxins in your body, and it all flows out through your chest, through these little ducts that drain here. So the better your flow in your body of all these types of things, the better your body is functional. And that doesn't mean, we want it to flow at 1,000,000 miles an hour. That's not the concept. Concept is whenever I touch myself here with something sharp and I poke myself, I need to know in milliseconds, hey, there's something sharp, and move my hand away. I don't want to touch here with something sharp and like 20 minutes later, I'm like, oh my goodness, it was something sharp. And that's just where energy flow into the brain is weak. And so many people do it. By the time they get here, their flow is so bad that they can't even identify there's certain things we're doing. They can't raise a foot. They got foot drop. They're paralyzed. It's obviously much easier to start earlier. And that's where we are as a staff, with my staff and my family. We try to keep our nervous system at 85% or above so that we don't crash. Yeah, I'm Dr. Chris Cormier, founder of the Neuropathy Institute, founder of the Neuropathy Foundation, founder of Body Chargers. We have so many other inventions. I have a product I founded called Oil to Air. We have a healthy Cajun seasoning called Healthy Cajun. I founded that. We have so many different things that are all just dedicated and focused on trying to maintain these 30 trillion cells in the body, and just a lot of this stuff we've discovered personally through me and my family, my staff, my patients. And then it's just carried over into thousands of patients, where something we make as a discovery turns into helping 1,000 more people or more. So it's just been such a great career. I've been in practice 25 years, and every single minute of every single day, I've literally just been focused. I cannot get enough of the way our bodies are made. They are so beautifully made. And this thing right here has full capacity to heal itself just about at anything. That faith in your body and understanding your body, how it works, has been what's fueled me, because we've been able to just witness so many different things, from, paralysis being reversed to aches or pains going away instantaneously right in front of your eyes, thousands and thousands of those, to concussions being completely going away, to things that you would never think are possible. And that's what we've been doing, is proving the system wrong. The system, is kind of one where it thinks you have to drug, surgery, the body. But in essence, the body shouldn't need all those things. And there's exceptions to the rules. If you've got a massively torn ligament, or you break all your bones, there's some exceptions to the rules when it comes to it. We don't say that medicines or drugs are never indicated, but we try to use them minimally throughout the course of your life and get your body to heal itself. So that's been the journey, and and I'm still not stopping. I've been in practice 26 years, and as you can tell, we made this discovery 7-8 months ago, and I'm still not stopping. We may make another discovery in the next 2-3 months, who knows? And all of it is geared to this one mission of helping people worldwide to help themselves to stay healthier without drugs, injections, or surgery.